Primarily, we're going to talk about the English-speaking countries, Canada and the United Kingdom. Canada has a single-payer system. Private insurance is illegal. Everybody goes to the government plan. In England, if you've got money, you can pay for your own health care. But in general, people use the government plan. Let's talk about England. The main term to learn about England is waiting lists. Waiting lists are a fact of life there. These statistics are just amazing. As many as 750,000 Britons are currently waiting admission to hospitals. England cancels up to 100,000 operations per year. Imagine. It's Tuesday night, Wednesday morning, you're going in for an operation. You do all the preparation, all that wonderful stuff. You show up. They put you in a gown. They put the IV in. You wait around for a while. They go, sorry, we're full today. Come back later. Cancer patients can wait up to 8 months for treatment. Let's talk about cancer. Colon cancer. When you're diagnosed with colon cancer and you're considered treatable, 20% of those people are incurable by the time they finally get into treatment. They have to wait so long. Okay, 1 out of 5. Wait times. Great Britain's official target for the time to get a lab test or an x-ray is 18 weeks. Okay, compare that to here. For most specialties, only 30 to 50% of patients are treated within 18 weeks. Over 50% of British patients wait more than 18 weeks for care. Now just think about it. When you go to the doctor's office, how upset you are when you have to wait 45 minutes. Imagine 18 weeks.
4 months.
New drugs. I talked about pharmaceuticals before. Breast cancer drug, Herceptin, was proven to be effective in 1998. England didn't start buying it until 4 years later. So you better hope your breast cancer got diagnosed after 2002 rather than before. They do rationing in England, very explicit rationing of healthcare. They've got an organization, and I'm not going to spend a lot of time on all the organizations, but they've got the National Institute for Health and Clinical Excellence. They call this NICE. and these are the doctors who decide basically who gets care and who doesn't based on the available resources. And in the current bill, my understanding is they're going to do the same thing here. And so if you're 30 years old and you have kidney failure, dialysis is a good thing, you'll get that. But if you're 72 years old and you need dialysis, you might not get it. In fact, at one time, I'm not sure if this is still true, if you were over 50 in England, you couldn't get dialysis. And here, over 90% of our dialysis patients are over 50. Okay? And they have what they call QALY, which is called a quality adjusted life year. And what they figure out is a year of life is worth about $50,000. So if the treatment costs more than $50,000, you don't get it. If it costs less, you get it. They want to get a reasonable value for the money. And to some extent, this makes sense. The problem is in how you implement it. As Bob showed, we spent a lot of money in the very last year of life in the United States You get sick and you get admitted to the expensive care unit. And that slide showed it very graphically. And, you know, if you were dealing with a finite pot of money, this is how they do it. And this is how they're talking about doing it here. Again, in England, if you want to pay for it, you can pay for it. In Canada, you can't, and I'm not sure what's going to happen here. Let's talk about Canada. You remember that word from England? They got it in Canada too, waiting lists. 800,000 Canadians are waiting for treatment at any given time. If you're referred by your general practitioner to a specialist and then to final treatment across every specialty, good, bad, it averaged about 18 weeks in 2005. That doesn't include the time waiting to see your general practitioner to refer you to the specialist. Thanks. This was published. At least 50 patients in Ontario alone have died on the waiting list, waiting for a heart catheterization. I'm not sure how many they do at the Cleveland Clinic every day here, but you know, it's probably at least 50. You know, we have the capacity to fix this in one day if they just drive across the border. I love this. This came from the Canadian Supreme Court Chief Justice in an official ruling on healthcare, striking down part of Quebec's universal healthcare law. It is undisputed that many Canadians waiting for treatment suffer chronic pain. And then, quote unquote, patients die while on the waiting list. Okay, right across Lake Erie. Thanks. Doctors. Canada has 2.1 practicing docs per 1,000 people, far less than the US. Nurses are a little better, but they've been declining for the last almost 20 years. Technology, I think the next slide, is also limited. We in the US have 5 times as many MRI units per million people, 3 times as many CAT scanners, and there are more CT scanners in the city of Seattle than the entire province of British Columbia. Actually, in Canada, if your dog gets hit by a car, you can get an MRI for your dog that day because the veterinarians take cash. Okay? But if you get it, you're in line. You would think that with universal coverage, they would do better at well care. Remember I talked about well care versus sick care? Not so much. US patients are actually more likely than Canadians to get preventive care. We are better at the common screenings for serious disease: breast cancer, cervical cancer, prostate cancer, colon cancer. All these are really easy tests. We do them better than the Canadians.